Capitol Report is a production of Senate Media Services.
This week, essential workers described their experiences early in the pandemic in hopes of receiving hero pay. Governor Walz holds a ceremonial signing of the Veterans Restorative Justice Act, and the Women's Suffrage Memorial gets a facelift. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Lurkey. The Frontline Worker Pay Working Group, comprised by a bipartisan, bicameral group of legislators and 3 agency commissioners, has been meeting bi-weekly since late July to hear from workers who remained on the front lines during the early days of the COVID-19 pandemic. The group is tasked with developing a plan to distribute $250 million in bonus pay. Here are some highlights of workers' testimony.
I represent over 80% of the nurses in Minnesota are M&A nurses who work in hospitals. And I'm here to tell you about what it's been like on the front lines and the risks that we have taken. And the best way I can do that is to just go from personal experiences that have happened to me with the assurance to all of you that nurses all across the state and the nation have experienced the same things I have. And I have to start the very first night that I came on back in March of 20. When I went onto my floor and a whole group of young nurses flocked to me saying, is it true, Mary, that we have one N95 to wear until it disintegrates off our face? A week or so later, we wore that mask for 10 whole shifts before we got a new one. These were reserved for the ICU nurses. Our floor nurses didn't have any masks. Our nursing home nurses didn't have any masks. They wore cloth face coverings. And many of them ended up sick. And I remember the night that I had to take care of a coworker from the med-surg floor who had ended up sick and was intubated, fighting for his life on a ventilator. And I remember thinking, feeling like I was a failure as not only a nurse leader, but as a labor leader, feeling like I had failed this person because I didn't get him the right protection that he needed. He survived after a month and a half on the ventilator. He's back to work, thank God.
Like many of my colleague essential workers, we assumed our role with responsibility, courage, and bravery, so that those that could work from home, so that our little Minnesotans and the vulnerable elderly didn't run a risk. However, holding my role in the production line almost cost me my life. I have survived to realize that me and many others like me do not have the support that reflects our work and our essentiality.
If I wanted a paycheck, it was mandatory that I be in the school building for all contracted hours. Teachers were able to work and Zoom from home, but paras were not. As a result of not being able to work from home, I was unable to help my children with distance learning. This took a toll on my older children's grades and on my own stress level. I needed the paycheck to support my children. Having to make a choice to support them financially or educationally was extremely hard.
You know, some of us were working 10-hour days every day, and this went on for weeks. After the mask mandate was in place, we all learned a little more about COVID, and our worries turned to ourselves. And are we going to get sick? Are our coworkers going to get sick? Are we going to bring COVID home to our families? And are our families going to get ill? I changed my daily routine that after every shift, when I would return home from work, I would spray my shoes down with the Lysol disinfectant. I would immediately remove my clothing and go shower. And I did this after every shift. I would do these things before, saying hello to my family, my wife, my kids, getting hugs, just to try to keep everybody safe at home.
Most people I know have at least a couple of friends who got COVID. In my plan, more than 50% of the workers got COVID. While things have improved, COVID is still here in our community and is still here for me personally. I struggle with after effects, lingering symptoms, and fatigue.
Unfortunately, the pandemic enabled Many of our employers take advantage of existing systems of discrimination to ensure this money might not make it into the hands of the people who need it. It is critical to ensure that this program and how it's distributed is easy to access, fair for families and for the people who need it the most, and to target the widening financial gaps that swallow up the lives of working people.
I remember the first time we had a COVID positive resident in our memory care in one of our communities. And if you don't know this, the virus is deadly. And we didn't know, there was nothing we could do. I remember the staff reaching out to me and saying, "What do we do, Erin?" And I said, "We just have to pray." And I said, "Do what we always do." And they did. That's exactly what they did. They came to the resident, they came to the family. We did a dignity walk. That resident passed away. They cried, I cried, we all cried. It was our first death. And all we could do was watch the virus. And the staff showed up the next day. They showed up, and they show up, and they show up.
And my question to you, have you ever been surrounded by 40, 50, 60 people all coming with this new virus potentially, all coming around you clamoring to get that new real ID or that enhanced license, the license renewal road tests and written tests? We were overwhelmed, and I, for the first few weeks, directed hundreds of people that stretched throughout our strip mall where we're located in and tried to separate them by 6 feet. In fact, it even bled off into another medical clinic that's right near us. And we didn't have medical gowns or medical shields or a ventilation system that could protect us.
In part because of the lack of PPE, I was infected with COVID-19 late November, early December. Myself and another coworker were infected by an elderly patient with dementia. She had COVID and kept removing her mask. I then, in turn, had to quarantine for 2 weeks. The presumptive workers' compensation law that you passed was the only reason that my quarantine time was paid. I have not gotten a COVID bonus or premium pay from my employer. The hardest part of my COVID quarantine was the time that I lost. When I quarantined, I had to stay in one part of my house away from my husband. I knew it was going to be a long 2 weeks without seeing him, but I also wanted to make sure he was protected. Before my quarantine ended, my husband passed away suddenly and tragically. COVID took away the last time I would ever have spent the last 2 weeks that I would have spent with him. Even now, like so many widows that I seek comfort, the lingering smell of his clothes, anything to bring back the memories of him, I can't smell because COVID took that away from me. I know you can't give me back that time or take away the horrible memories of the fear and the terror that hospital workers lived through. But a significant bonus to all of us hospital workers would at least show us that our community appreciates the sacrifices we made to protect them.
I'm just asking you to please consider us for some of this bonus money. We do not have the opportunity to earn bonuses or merit pay. I know there's not much money there when it comes down to it. And when somebody says, well, it needs to be a significant amount. Well, you know, sure, I would love to get $1,500, and I think I deserve $1,500, but I'd rather get $200 than nothing.
This week, Governor Walz held a ceremonial bill signing to highlight the recently enacted Veterans Restorative Justice Act.
What do we do with veterans who come back with the wounds of war, whether physical or mental, and end up inadvertently into our criminal justice system with no way to try and bring the restorative justice, no way to get them into a system that we want them to be in, which is the VA system and all those public supports. The idea that you intercede in a very meaningful way in that criminal justice system before you put someone into incarceration, parole, whatever it might be, that it's better to address what the systemic or root cause of that is, whether it's addiction or, in the case of so many folks, the impacts of the incidents that they saw while serving this nation.
I have a veteran that actually had to reintegrate from active duty and then from 2 extended deployments in the National Guard. And I can tell you every single time it's different, but it's always hard. And a lot of our veterans, it's difficult to when you're making life and death type decisions, when you're in country, when things are pretty much straightforward and simplified, to be able to switch over automatically and go into a well-organized society and reintegrate it is difficult. So this is an opportunity for those veterans that are having those difficulties with the reintegration to be able to have some help and assistance, something other than just going and going to jail.
There's a lot of smiling faces in this cast of characters behind you, and I can tell you that each and every person here and some behind the scenes back here had a hand in this. There was a lot of advocacy going on at the bars downtown St. Paul that I think was well deserved. But at the end of the day, we came together and we got a bill passed that I think was a good bill. I'm stealing this marker because I think after voting for this bill 9 times, I counted this morning, 9 times I counted this, that I can just say thanks to the commissioner and all the veterans organizations as we go forward. I asked Mr. Hunter this morning, I said, how many people do you think this is going to help? And his answer kind of surprised me. He said thousands.
History tells us that for as long as veterans have returned from war, most have come home stronger and wiser from their service, immediate assets to their communities. Some, though, have always brought their wars home with them in the form of invisible injuries that, untreated, very often lead to self-destructive, reckless, and sometimes violent behavior.
I stand before you probably the most fortunate veteran in the state sometimes. This is a challenge coin that the Ramsey County Veterans Court gives out to its graduates. I was only the 23rd in many years. Doesn't mean you don't get through the court and have its benefits, but you have to meet all of its requirements too. I don't leave the house without this thing in my pocket, and that's been that way now for the last 3.5 years. Veterans Court, as the governor mentioned, this is not a place to get over. But more importantly, this is not a place where a veteran gets his or her life back. Not in the least. They get a new life. And a new life that is productive and satisfying and doesn't really, emotionally in particular, resemble anything of their previous life.
Senator Andrew Lang is both the chair of the Veterans and Military Affairs Committee and a major in the Minnesota Army National Guard. This week saw both a ceremonial signing of the Veterans Restorative Justice Act and the groundbreaking for a new Minnesota Veterans Home in Preston. I spoke with Senator Lang in May about those issues and others impacting Minnesota veterans. You are new to the role of chairman. This legislative session is your first as the chair of Veterans and Military Affairs Committee. You've done well enough that Minority Leader Susan Kent praised your leadership on the Senate floor. And I'm curious, does being a major in the Minnesota National Guard provide a unique perspective for this work?
Well, first of all, thanks for having me, Shannon. I think so. I think having, and this is probably something that most military service members would say, that if you haven't worn the uniform, or you haven't gone through, even something like basic training or a service overseas, you probably just don't quite get it. A lot of people have family members that have served, and they have a unique perspective as well. But yeah, having that experience, I think, is important. So when you start making decisions, whether it's behind a gavel or on a committee bench, it's, I think it's entirely important. That's why we oftentimes pick teachers to lead the education committee, or lawyers on judiciary, or CPAs on the tax committee. I think it's important that they have that experience. So, yeah, and as far as Susan Kent's complimentary remarks, I appreciate them. So.
Well, let's talk a little bit about the bill. The Veterans Omnibus Bill was rolled into the State Government and Elections Omnibus Bill. Your proposal spends $8 million to support veterans in a number of ways, making sure that they're cared for, as you said, from when they return from service until their golden years. What are some of the efforts that would be funded?
Well, when they return to service, so we've worked on a couple of real, this is something where the military and vets area has not, we've seen ourselves suffer, and it's in veteran suicide and PTSD and other issues where the department's really taking a close look on that and hopefully leading the way on how we're going to try to accomplish stopping those veteran suicide. I think that's important to mention. We talked about jobs and training in GI Bill for those veterans that are in the ages that can go back to school, learn a new trade if they need to, or possibly increase upon some of the education that they have already. So, and then golden years, what I meant by that was we've funded 3 new veterans homes, and we have a substantial veterans home system as it stands right now. But as we move forward, how can we increase that? How can we make that better? And I think honestly, Senator Newton and myself, as the DFL lead in the Senate Veterans Committee, he doesn't like the outstate homes, but I said that's fine. We'll get the outstate homes done, and then we're going to come back to Minneapolis and work on the homes there, or the beds there. So I've made that commitment to him. But yeah, there's definitely this is my 5th year in the Senate, and this is probably the most money we've thrown at veterans issues for since I've been here, and I'm glad to be a part of it. So.
Well, so you mentioned. Well, one thing you didn't mention actually is homelessness, and you did mention it on the floor. How big of a problem is homelessness among veterans, and what is proposed to help?
Well, so we have worked with the department, the housing department, and both military and Veterans Affairs committee agencies, and we put some money. I think it was $1.5 million towards ending that veterans homelessness. And this is something where Commissioner Ho and the governor, and I think rightfully so, said they can statistically eliminate veterans homelessness. And I think we have about 200 and just under 300 people that are veterans and homeless. What this program will do is not only get them off the streets, but the intent is to keep them off the streets. How do we get them job trained? How do we get them housing secure? And hopefully if it works out right, we can have some sort of a path lane for other programs throughout the state to follow. So as we go forward, we can say, well, this is how the vets did it with 300, individuals. Can you do the same program with others? So, we're going to give it a whirl.
Now, one thing that you did mention was the problem of suicide among military members, and you also mentioned that you've personally experienced this. I assume you know people who have taken their own life. There's money for recognizing veteran suicide prevention and awareness, having a day set aside for that. But there's also some other stuff. Can you talk about that?
So it's all mental, a lot of mental health stuff. There is, this is, like I said, this is a big initiative of the agency, and I've supported that as much as I possibly can. And I think you can see it it's the only area that I said, yep, throw every dollar that they ask for towards it. I think it's important. Not that I don't think that homelessness is, I just wanted this to be the #1 target of the Senate committee. As we move forward, yeah, there's, in my personal experience, that this is something where it isn't, I think we've talked about the numbers and how many numbers can we affect. And this is maybe something where just that one single person that we can stop from doing something rash is a good thing. And yeah, that's, in my personal life, when you come back from deployment, you're not quite ready. And the military and the Beyond the Yellow Ribbon and all these groups that have worked really hard to try to fix that, to try and soften the blow. We have 90 days of reintegration training or reintegration things with our friends and family as we come back into the States, and they're trying to figure out what works. And and I think it's making effect. But there are a few people that I've known, and even personally, I wasn't exactly the happiest person when I came back from either deployment, and you're kind of just in a different state of mind. So I think it's important that we took a good look at that and try to try to bring our boys and girls back from a tough assignment, and get them as what they were when they left. So it's important, and this is a step in the right direction.
Now, related to that is the problem that stems from PTSD or some other service-related trauma, veterans coming back and getting negatively interacting with law enforcement. There is an expansion of the Veterans Restorative Justice Act to provide that path to rehabilitation. How will this work? How many people will it affect?
Well, again, speaking from a personal standpoint, that's when I know, dozens or more than dozens of people that have returned from overseas and, gotten the DUI, gotten this, another infraction of some other sort. And partially, is it due to PTSD? Is it due to, not being able to handle emotion, not being able to handle a stressful situation? And I truly believe that yes, it has a lot to do with it, because those guys and gals just went through something that, less than 1% of the population is going to experience. And even a smaller portion of those folks that were deployed actually, served in combat roles. So it is a small number of people we're talking about, but I know some of them. I know some of them personally. What I would say is the Veterans Restorative Justice Act is both based on some of the veterans courts that the state has had operating for years, and it probably goes a little bit further. And there's two different versions of it now. The Senate and the House both have a version. In the Senate, we have carried the House version, and the House has portions of what the Senate is carrying now. I think at the end of conference committee, and we just started yesterday, and again, in a few minutes here, we're going to kick off our second day of conference. We will have a bill that will do what we want it to do. That is, providing a court a little bit of a path to allow some of these vets that may have extenuating circumstances to say, you know what, we're going to give you this chance to get your life back in sync, and you're not going to be paying for it for the rest of your life. We're going to allow you to have a good experience here and hopefully clean your record up. So,
Senator Andrew Lang, thank you so much. It's a pleasure to talk to you.
Thanks, Shannon.
The Women's Suffrage Memorial at the corner of Cedar and Aurora on the Capitol complex commemorates the efforts of the Minnesota women who tirelessly worked to achieve women's right to vote. Recently, retired CAP Board Secretary Paul Mandel joined me to talk about the recent renovation. The Minnesota Women's Suffrage Memorial is now over 25 years old, and it's recently undergone a facelift. Let's start with the lattice. What does it represent, and what was done to sort of bring it up to date?
Sure. Well, it's meant to be a screen, an obstacle, which was what women met when they were trying to get the vote. It also has, on the lattice work, it has the 23 names of women suffragettes from Minnesota. And Minnesota ratified the amendment the year before it became a full amendment. So we had a celebration here in 2019, for instance. But between the wall and the lattice work, you're obstructed from getting into the garden, which just exemplifies how the women were obstructed from getting the vote. And the wall was redone, repoured, and the lattice was cleaned up, and all the explanatory plaques that are along it were also cleaned and repatinated and such.
And this garden has changed a lot over the years. I think we talked once about how people wanted it to be roses, and then they wanted it to be this and that. And now we have a pollinator-friendly garden. Talk about the choice of plantings, what they represent, and the ease of care, perhaps?
The garden was completely replanted. We had to take out all the old soil because it was so infested with weeds. So we replaced about 3.5 to 4 feet of soil. The memorial was supposed to have white and focus on white, yellow, and purple, especially white and yellow as the colors of the suffragettes. We started with prairie, and because this whole area is, of course, watered for lawns, the grasses were so invasive and weeds and everything else, it was the wrong condition for prairie. And of course, prairie flowers, people are used to the hybrid forms of Shasta daisies and things like that, where you see a lot more showiness. Whereas prairie, you have a small plant at the bottom and a stalky, small flower at the top. and it was never very successful because of the heavy watering and fertilizing in the bluegrass. It was favorable to bluegrass, not prairie. The soils were too good, et cetera, et cetera. So we abandoned the prairie for hybrids. We infilled for things that had not succeeded. And in this last iteration, also over time, we consolidated the gardens because there were like twice as many gardens and they just couldn't compete with the grass. So we consolidated them into larger planting beds and went to total pollinators in this example. Even the shrubs are 9-bark, which is a pollinator. And we purposely focused again on the purples, yellows, and whites. And right now you're seeing a lot of the yellows and the whites, a lot of the yellows and the purples.
One unique aspect of this memorial is the glaciation idea, talking about how long it took for women to get the right to vote. Now, it used to be these sort of gravelly pavers, and it was misunderstood over time. Now it's been upgraded, maybe more permanent. Talk about the evolution of that.
We replaced these what people thought were originally sidewalks, which were basically on-end laid stone that was deteriorating. So we replaced those with poured in place concrete that will last longer. This just reinforced both the retreat and the advance of the glaciers as kettles and moraines that we now have in like Taylor's Falls and elsewhere, where as the glacier retreated. But it was slow and evolutionary, just like the women's right to vote.
One final thing, there was one woman who was sort of spearheaded this effort, and there's a bench underneath a tree to remember her. Can you tell us a little bit about her?
Barb Stewler came to us like early, maybe 92 or 93, and she had an idea for a bench, one crab tree, and a few daffodils. And we started moving it around the campus, and we were down by the Veterans Building, and she's like, this is way too much war and stuff. And veterans, and she didn't want to invade their space, and it sort of got lost on the upper mall. So we picked this spot, but this spot was reserved for 3 large gardens. We have the Workers' Memorial down the bottom, and so the thing just exploded in size. And we had a competition. It was a very, very tight competition. We had six submittals, and it was decided by 1 vote to go this route versus I think it was a sundial with sunflowers as the theme and such. But she stuck with it through everything, and through the planting nightmares and through the weeding. She even had her women out here at one point weeding because the plant crew couldn't keep up with it. And she was just, she was unstoppable, but she had staying power and the patience to deal with bureaucracies and the weeds and all the nightmares. So we purposely did a bench to her, and they did the fundraising for that.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Lurkey, and on behalf of all of us at Senate Media Services, thanks for watching.